There is a lot of evidence actually in the new treatment for patients with EGFR mutations or ALK translocation. That means people who harboring any specific alteration that we can treat in a specific situation that we call oligoprogressions. This kind of progression is the patient who have, for example, brain metastases less than 3, for example, or small sites of metastases in other parts of the body. This kind of evidence is regarding the combination of therapies like EGFR or ALK translocation inhibitors with radiotherapy or even with surgery. So it's a very important topic issue in this kind of subpopulation. There is a lot of evidence, but there's still a lot of things to learn about this issue. There is a lot of things to learn yet in this issue. For example, we know that the heterogeneity of the tumor is one of the major issues for this kind of therapies. So we are not able at this moment to see if it's the sequential or if it's a concomitant kind of therapies are better or not, because the data are very initial data. The knowledge of the molecular biology is crucial for this, for answer these questions. All the efforts that they are doing with radiotherapy in combination with erlotinib or sequential, for example, with other drugs for patients who harboring specific alterations are very important for this kind of people. Patients who have non-small cell lung cancer, 20% of our patients with stage 4 have the possibility to develop metastases, for example, in the brain. And that is a very important issue because it's a sanctuary for the metastases, the brain, and we need to improve our knowledge to try to improve the quality of care of this patient. For example, in the specific subgroup, the patient who harboring any mutation, translocation, or specific rearrangements, we are able at this moment to see that the combination with other treatments, for example radiotherapy, are very important to improve the care of these patients. So the idea to combine this kind of therapies, radiotherapy or surgery, is very important. Obviously, the stereotactic radiotherapy in brain metastasis is one of the major help that we can have in this patient. But don't forget that it's also important the pancranial irradiation, because we have a lot of data about the efficacy of this treatment. A recommendation for clinicians who see patients with a specific alteration in non-small cell lung cancer, for example, EGFR mutation or ALK translocation, is very important to take care very carefully about this patient. Not all the stage 4 are the same. There is several diseases in a one stage 4. There is patient who progress quickly and very symptomatic, but there is also patient with progression, small progression, oligoprogression that we call actually, and also with a symptomatic disease. So it's very interesting that we need to take care about the patient asymptomatics, because, for example, it's necessary to look the brain sites with the MRE, for example, just to check in this patient who have stage 4 disease, if they have not asymptomatic metastasis in the brain. That is very important because actually with the data we are able to provide at this patient an opportunity to prolong the overall survival with a strategic, we change our strategic, continue to blocking this pathway, the alterated pathway, with the addition, for example, of some techniques of radiotherapy or surgery when there is an oligometastatic disease.